When the lockdowns were first set in motion, they were based on the idea that the coronavirus was a new deadly pathogen that would kill millions of Americans. But as the months have gone by and we've had more time to study the virus, we've learned that's simply not the case. I spoke with Dr. Brian Tyson, a medical doctor who owns and operates a clinic in Imperial Valley, California, one of the COVID hotspots in the state. Dr. Tyson has successfully treated and cured some 2,000 coronavirus patients at his clinic and says the media is making the virus seem like a much bigger problem than it really is.
Yes, there are subpopulations that do have a hard time with it, but for the most part, it's not that bad, especially for those under the age of 40.
For evidence, we need look no further than the Centers for Disease Control itself, which is continually updating their website with the latest data on deaths attributed to the coronavirus. As of October 28, 2020, there are some 230,000 deaths which are being blamed on the coronavirus. But let's take a closer look at those numbers and break them down, because when you do, something very interesting happens. By looking at this chart, and don't take our word for it, this is from the CDC itself, which you can see right here. We can see that yet again, COVID-19 is rarely the actual cause of death among coronavirus patients. According to the CDC themselves, of the 230,000 deaths attributed to the coronavirus, a huge number of them died from other causes, such as pneumonia and influenza.
88,000 had a diagnosis of influenza and pneumonia, including COVID-19. So did they die of influenza? Or did they die of COVID-19? Or did they die of pneumonia?
Another 19,000 died from chronic respiratory diseases. Chronic meaning conditions they had their entire lives and had nothing to do with coronavirus. 46,000 patients died from hypertensive diseases. 24,000 died from heart disease, and a whopping 40,000 people died from cardiac arrest and heart failure. Heart attacks, in other words. Yet all of these, even patients who died from strokes, were marked down as dying from the coronavirus. Doctors who spoke with One America News explained that over 130,000 patients who are being considered COVID-19 deaths already had life-ending diseases, including cancer, dementia, Alzheimer's, kidney failure, and obesity. However, most astonishingly of all, the CDC even counted over 7,000 patients who died from self-inflicted injuries, poisoning themselves, and even, tragically, suicides. Yes, people who killed themselves were marked down as dying from coronavirus. According to Los Angeles County public health officials, they admit that anyone who tests positive for coronavirus from the last 90 days and dies from anything, including heart attack